vir die SANS is dit baie belangrik om deel van trust te wees. Die SANS is al baie nagevors en dit maak hulle versigtig en bang. Ons moet onsself kan beskerm, maar ons wil ook met mense saamwerk. En ek dink die trust projek is 'n projek waarin ons kan saam leer en saam praat, saam doen, sodat ons verstaan kan mekaar.
I'm really excited to be part of this interesting project, and I'll be looking at compliance, because compliance is a real challenge in a globalized research context. The principles are very clear, but when it comes to interpretation, application, that's where the challenge lies, because people look at them differently. And in terms of compliance, we'll be delighted to look at ways of developing tools which can guide people, whether it's through accreditation system, follow-up, to really be clear on what they need to look at in order to ensure that there is compliance at a global level, not a fragmented approach that deals with different contexts in a different way, because these principles can guide people across the board without any fragmentation.
I think trust is one of the single most important precondition for working together on complex matters, because complex matters by definition are difficult to understand. You have to rely on others because you do not know all the details of the complexity. If you can trust somebody, you can assume he means well or she means well. This research project, we have an additional factor, that is leaving no one behind, which was one of the main messages in the UN General Assembly on the 2030 Agenda for Sustainable Development. Leaving no one behind means we have to encourage, we have to support research with developing countries, in developing countries, and there it is very important that we are aware of vulnerabilities, that we are aware of respecting cultural differences while not losing shared values.
It's very exciting for me to be the coordinator of Trust. It's a project on a topic that is very pressing, one of the main problems of the 21st century, namely how to conduct research ethically in low and middle income settings. And we have two major case studies with people helping us, the son from the Kalahari and the sex workers in the Majengo slums. They are going to help make this a real project with real impact and real output that we will deliver in 3 years.
In Nairobi, I'm involved in mobilizing gay men who have sex with men, who sell sex, and female sex workers and IV drug users. These populations are marginalized, highly vulnerable because one, they are involved in illegality. That means the legal framework does not support whatever they do, but they require healthcare services. And when we mobilize them, we provide them a platform of a package of healthcare services that prevent them from getting HIV. And then research is actually built on that. In terms of now voluntariness, in terms of the research participation, that becomes a challenge, because one, you don't know whether they're participating because they think you might deny them the care, or they're participating because they actually want to do it. And then the other thing is that most of the things that we are involving them in involves one of the interventions that is protecting them from getting HIV. So the question of voluntariness and inclusiveness becomes a little bit murky for me. It's something that we need to really investigate under this trust project.
This project is very important for the SAN. For many years they've been trying to work with research, but they've never engaged the research community. And this is an opportunity for them to use the law, but more importantly to engage the research community so that they can be researched but have faith that it will be useful for them and ethical.
So this is a really exciting project that we're embarking on, and I'm really looking forward to it. I'm going to look specifically at agricultural issues, and I think the focus of many of the participants in this project is on health and on clinical trials for all the right reasons. But agriculture also raises some very, very interesting questions around ethics dumping, because agriculture is focused on very, very few species which feed the majority of the world. Yet it ignores the fact that 90% of farmers, for example, are reliant on their own seed. So the whole research agenda in agriculture is swung towards the interests of these few crops and the interests of a very few large multinational companies who dominate the research agenda and enter into research partnerships with countries like South Africa in my case, to do research on these few crops, diverting interests away from the majority of species which communities are dependent on.
Very pleased that Trust has decided to involve the use of animals in research, or bioethics or animal ethics particularly, because it really is a problem for people carrying out research on animals because it causes them pain and suffering, and nobody particularly wants to do that. So the question is how we can minimize that, or even how we can reduce the number of animals that are involved in animal research. And we only use animals in research when there's some benefit. And of course that benefit will have different values according to the country we're talking about. So I think it's important we look at those values because they'll vary across the world, and make sure that animals are used when only necessary. And there's some global harmonization here, because otherwise countries will go on thinking they can use animals in a particular way and it's acceptable without questioning that use. And one of the points about Trust is it can raise issues that people think about and think more carefully about how they use animals in research.
For UNESCO it's important, this project of Trust, because it really shares this aim of having research, but at the same time making sure that no population is ever abused particularly on the rights and welfare. And we have been really dealing with this with vulnerability benefit sharing. So and particularly fostering proper international collaboration to avoid this kind of exploitation.
Activities related to global health have contributed to benefits such as research startups, job creation in high-income countries. There is a need for a mechanism to provide the products resulting from health research, combining these with jobs, economic development, and social development in low and middle-income countries. Recently, CORED has embarked on the creation and development of a mechanism that we call the CORED Fairness Index, which is a certification system that hopes to align the fairness in research practices between partners situated in the global north and the global south.
As pharmaceutical industry, we are really happy to be part of the Trust initiative. The issue of ethical dumping is really important for us because we operate worldwide, including in parts of the world where health systems may be vulnerable, ethics committees may be vulnerable, more importantly, patients may be vulnerable. For instance, one issue which is very dear to our heart is the issue of healthy volunteers in resource-limited settings, not just in resource-limited countries, but also in some settings in Europe or in North America. And we feel that these are among the most vulnerable populations because they do not stand to benefit anything from taking part in a clinical trial except to get money. And there is no problem with that as long as their safety is ensured and also the quality of the data they provide is ensured. So we know that some countries have implemented really good rules to avoid having healthy volunteers becoming sort of professionals and taking part in multiple trials without somebody knowing it. But we feel that there are some safeguards that should be put in place to ensure that we do not take advantage of these highly vulnerable populations. We know we have a very bad image out there, especially when it comes to resource-poor settings. And this is in spite of the fact that we uphold extremely high quality standards, which we feel contribute to raising the standards of clinical research in developing countries. So we know we have this bad image, but being part of Trust, being among other stakeholders that deal with these extremely complex issues is really important for us to be recognized as responsible partners when it comes to improving access to healthcare and high quality research.
I'm very pleased to be an external advisor on the Trust project. In particular, representing the Wellcome Trust, we are very interested in supporting research in low and middle income countries, but also ensuring that the international collaborations we support are more equal and that they do not exploit either the researchers in lower income settings or of course the research subjects themselves. It's really exciting to be involved in this project, and hopefully we can learn from the ideas being brought here from the participants who are drawn from countries and settings right across the world in all different contexts.
At ACF we work with highly vulnerable people and essentially with displaced and refugee populations, and we provide them nutrition interventions, and it's very difficult when we do research because there is not any ethical guidelines or standards.
In any country, of course in Russia or in any other country, it's absolutely necessary not to do something local, to correct regulation, legislation, ethical evaluation system, to have very appropriate bodies. It's not really what solves the problem, especially for international and global research.
India is one of the leading countries in Asia where clinical trials are conducted within the country as well as with international collaboration and the MNCs. And there was a boom of clinical trials in India from 2000 up to 2012, when it was seen that the large of unethical practices are going on in many institutions because of lack of awareness amongst the researchers, ethics committee members, as well as the patient population. And so the government and the Supreme Court of India has been very critical about it, and one of the recent notification issued by the government of India is all ethics committees in India which are approving clinical trials have to undergo a process of accreditation of ethics committees, accreditation of investigators, as well as the accreditation of institutions. So the mechanism is now just started. I think in the next 1 or 2 years, unless this exercise is undertaken, institutions cannot take up clinical research in India.